Okay, I'm honored today to give the tribute to Dr. John Mcdougall. Dr. John Mcdougall was the greatest doctor who ever lived, and we're going to talk about, in this order of topics, who is Dr. John Mcdougall, who is the greatest doctor, what are Dr. Mcdougall's medical achievements, how did Dr. Mcdougall die, and what are Dr. Mcdougall's best quotes. Okay, here's a picture when he got married to Mary. You know, this is back in the 1960s. Let me get myself out of the way here. And here's a more recent picture of him with Mary. And he's about 70 years of age in this picture. He's got the characteristic 1960s long sideburns. And John Mcdougall, he's a doctor that fought for you. You don't make money helping the proles, okay? You make money by helping big pharma, big insurance companies. And it reminds me of this quote from the Bible, 2 Timothy chapter 4, verse 7. I have fought the good fight. I have finished the race. I have kept the faith. Okay, so here's some background on Dr. Mcdougall. He argued that his program of teaching patients a plant-based diet, as had been proven by long experience in epidemiology with plant-based diets, could save the insurance companies lots of monies. You could get down the treatment for heart disease down to $4,000 or less. Whereas if you put in a stent, that's about $30,000 a piece. You put in, you do open heart surgery, a CABG, coronary artery bypass graft, you're talking about billing nowadays for about $150,000 with everything included, the OR time, the surgical ICU time. And the insurance companies kept giving them a runaround until finally one of them told them the real answer. They get a piece of the pie, and the bigger the pie, the bigger a piece that they get. So the more expensive it is, the more the insurance companies profit. So in a sense, the sad truth is that all big money is aligned against the patient. The big pharma companies, the big device companies, the big hospitals, and the big insurance company. They all profit by ripping off the patient. Okay, so Mcdougall tries to speak up for the patient, and it makes him kind of ostracized by the medical community. Okay. And he knew the other doctors would tell him. They would see patients come for follow-up coronary artery arteriograms, peripheral vascular arteriograms at his hospital, and they would show improvement. So the other doctors knew the truth, the ones that had close experience with it. And he worked at St. Helena Hospital, which was a Seventh-day Adventist hospital. And despite that, with the Seventh-day Adventist religion having a component of recommending a vegan diet, you know, going back to the original founding work of Ellen White, to eat a plant-based diet. Okay, but despite all that, they wouldn't send him a single referral. He was ostracized by his local hospital medical community. On many occasions, they would still, though, go to him for themselves, send their spouses to him and their children to him. But they wouldn't send their patients to him. And that's another thing a lot of people don't know, but that's how the medical community is. Dr. Esselstyn had the same experience. I've had the same experience in my work. Okay, and Dr. Mcdougall would take on some big opponents, okay? In 1980, he worked with a citizen group in Honolulu to pass an informed consent bill whereby requiring doctors to tell the truth to patients when they obtain consent. For example, a woman with breast cancer has the same survival. She doesn't get an extra day of life for having a mastectomy instead of lumpectomy, and Mcdougall insisted that should be told to the patient. The doctors got so pissed off at him that the med-mal was run at that time by physicians, and they denied him malpractice insurance. For a couple of years, he had to go bare, so to speak, means practice medicine without med-mal insurance, a very financially risky thing to do. And that's the payback you get when you help the proles, okay? Also, I want you to see what happens to him on Wikipedia. So on Wikipedia, you know, here's Dr. Mcdougall, the best doctor in the world, and how does he treated by mainstream Wikipedia? Wikipedia pretty much imitates what mainstream wants, what big money wants. It's not a free, objective, open source of information. It's what big money wants you to know on a topic. So here's how they describe Dr. Mcdougall. They said some of his dietary recommendations are not in line with mainstream advice. They are considered extreme, and not supported by evidence. His diet has been called a low-fat fad diet. It leads to boredom, feelings of deprivation because of the exclusion of favorite foods. The high fiber content can cause flatulence and possibly interfere with mineral absorption. This is all untrue. They're trying to slander him because they don't want people to be healthy, okay? And it says it can be deficient in vitamin D, calcium, omega-3, or potential nutritional deficiencies from following such a strict diet. In 1992, nutritionist Kurt Butler described Dr. Mcdougall's ideas as vegetarian extremism. They said that he is a vegan zealot, taking the low-fat vegetarian diet to extremes. By the way, the typical person, not only do we have herbivore physiology, we have herbivore mentalities. For a pack animal, a herd animal, the safest place to be is conformist, in the middle of the pack. The big achievers that go to the extremes, the proles, most proles, uneducated, illiterate proles, are afraid of that. So big money knows, if we want to scare people away from what's good for them, just tell them it's extremist. Just tell them it's an extremist point of view. And the average person will run with fear from that. Okay, so it goes on and on. McDougall's diet concepts are extreme and out of keeping with nutritional reality. Failure to consume dairy products they put themselves at risk for osteoporosis. Vegans who follow his diet may not obtain enough protein. So they say the exact opposite of the truth, and they're allowed to do it. Big money can say whatever it wants. The sad truth is, whereas regular people get in trouble for telling the truth. Okay, a lot of people did not like Dr. Mcdougall. Okay, big food doesn't like him. The processed food industry, the fast food industry. Big meat doesn't like him. Big dairy doesn't like him. Big pharma doesn't like him. The cancer industry hates his guts. The medical insurance companies hate him. The diabetes industry hates him. The hypertension industry don't like him. Cardiology stent industry and the olive oil promotion club of cardiologists, they don't like him. Cardiac surgery doesn't like him. Population control societies don't like him. They don't want the pros to be healthy. Here's a typical Dr. Mcdougall video. Cancer screening is a scam, okay? He pointed out what a joke a lot of this screening is. I've been involved in screening for over 30 years. What Mcdougall says is true. Okay, look at some of the people that Dr. Mcdougall hangs around with. This is Peter Gochke, the famous physician from the Cochrane collaboration. Mcdougall said he's the best expert in the world on the pros and cons of mammography. And here's what Gochke says. In medicine, there are very few people who like to hear the truth. Screening mammography does more harm than good and should be abolished. There are lots of asymptomatic cancers in the breast and the thyroid and the prostate that are overtreated. Psychiatry is one of the worst fields in medicine and does far more harm than good. Prescription drugs are the third leading cause. Properly prescribed drugs by the standard of care are the third leading cause of death after myocardial infarction and cancer. Big pharma is organized crime. Do you think hanging around with people like that makes Mcdougall popular with the mainstream? I don't think so. Okay, so then I want to show you here that he kind of reminded me a little bit of Don Quixote. Okay, so Don Quixote is the most famous book ever written in the Spanish language. And Don Quixote was a man of 50 years of age who was reading all these tales of knights and chivalry and the good old days, and he's like, how society has gone down, and he wanted to try to make things better. So he decided to declare himself a don, a nobleman, and become a knight and try to make things better for people. And in some ways, he's sort of seen as an overly idealistic comic hero. Okay, and in some ways, Mcdougall's almost like that to big money, how they view him. Mcdougall makes a declaration to friends and family and colleagues that he wants to be a nutrition doctor, and they kind of laugh at him. Well, gee, you could make big money, selling the pros drugs. Why do you want to do this nutrition stuff? How is that going to work out for you? And then this picture is kind of funny here in a sense. Here's Dr. Mcdougall in a sense as Don Quixote on his horse, ready to take on the big giants. And his advisor, this could be one of his friends, let's just say Doug Lyle or something, telling him, John, you might not want to piss off the insurance companies. John, you might not want to piss off dairy industry any more than you already have. Okay, you might not want to piss off the cardiac surgeons. They've got a lot of money, John. They can make life difficult for you. You might not want to piss off big pharma. Who knows what they'll do? Okay, so he's tilting against the windmills, the big giants, and it's a dangerous thing to do. But sometimes a man just decides he's going to do the right thing with the time he has left. And here's a quote by St. Augustine: wrong is wrong, even if everyone is doing it. Right is right, even if no one is doing it. And it kind of reminds me of Fyodor Dostoevsky. Sometimes a man must make a stand and set an example. And that's what Dr. Mcdougall did. Telling the pros the truth, trying to help them. And, it's reminiscent, the life of a hero, like the hero's journey of Joseph Campbell, whereby childhood is kind of innocence and pleasure and safety, and then they go through a dramatic event that's sort of a kaleidoscope that spins their worldview, and kind of shatters their innocence a little bit, like Mcdougall's big stroke when he was 18 years old. And then they sort of have to climb out of the gutter and try to make some progress. And they start making some progress towards the light of sunshine, like climbing out of Plato's cave. But often when you go 2 steps up, you get smacked back down. 2 steps up, smacked back down. And that's what I'm referring to is no one will send you a patient. Mcdougall also, he got fired from the TV shows, fired from the radio. He got smacked down big time. They took away his insurance, but he kept on climbing, fighting the good fight, the heroic fight to help the people. Okay, here's Mcdougall. He was, he's a great speaker. He's a great teacher. And he was on the TV shows and the radio. Because he refused to sell supplements, he got fired. He just said, no, I'm going to tell the population the truth. Okay, and here's what he's showing here. If you look at these flasks, these are to show the different caloric density of foods. And what Mcdougall pointed out is, starch is very low in caloric density. It stretches the stomach, so you get early satisfaction of hunger. Plus, it's slowly absorbed and it's slowly processed by the enzymes. Basically, starch is a polymer of glucose wrapped in fiber. So it takes time for the intestinal enzymes to peel that fiber off before the glucose can be slowly absorbed to the blood, whereas you barely fill up the stomach with these high-fat foods. Okay, here is Dr. Mcdougall in the ring, landing one on Big Meat right here. Big Meat is supported by Big Food, Big Pharma, Big device makers, etc. And then the other thing about Mcdougall, here he is, best doctor in the world. How does he get treated? Who knows? What's his luck? Is he a big billionaire? Does he have his own private island? Does he have his own harem? Does he have all these other things? Nope. His house is burned down, and he's kind of homeless. His library is burned down. And it reminded me of the scene from Don Quixote. A bunch of people got together. The priest, the barber, even his niece was in on it. And they took his books and they threw them into a big pile and they burned them in a fire. Oops, did I go back there? And they burned them in a fire. And then Doug Lisle had a nice tribute to Dr. Mcdougall, and he said if there was a Mount Rushmore for nutrition doctors to help the public, Dr. Mcdougall would be on it, and he definitely would be. Okay. And then another thing that, I think there's a tendency for people to think all doctors are the same, and nothing could be further from the truth. There's a tremendous difference between individual doctors, okay? And between a genius, too, like Dr. Mcdougall. And here's a good quote about geniuses. D.K. Symington, he's an expert on geniuses. He writes books about geniuses. He says, a genius is someone who transforms a field. Mcdougall transformed nutrition and really healthcare. I mean, basically, he gave you the big secret. Okay, the big secret is a starch-based diet prevents the chronic diseases. And all of these chronic diseases are called chronic: diabetes, hypertension, obesity, atherosclerosis, abdominal pressure syndrome, because conventional medicine can't cure them at all. That's why they're chronic. It never cures them. He showed you how to cure these diseases, how to prevent them. Okay, here's a quote by Oliver Wendell Holmes. The world is always ready to receive talent with open arms, but it doesn't know what to do with genius. Talent is a docile creature. It bows its head meekly while the world slips a collar over it. It draws its load cheerfully and is patient of the bit and the whip. But a genius says no. A genius is always impatient of its harness. Its wild blood makes it hard to train. Okay, Ian Fleming, the author of James Bond. All the greatest men are maniacs. Maniacs. They are possessed by a mania which drives them forward towards their goal. The great scientists, philosophers, religious leaders are all maniacs. What else but a blind singleness of purpose could have kept them in the groove of purpose? Mania is as priceless as genius. If a man knows he's doing the right thing and he decides he's going to stay the course, that's what it takes. Because when you're doing the right thing against a lot of opposition, most people just cave, okay? If you ever heard of the research of Solomon Asch, he pointed out if you have 10 Confederates at a table and then you bring in one study subject and all the 10 Confederates deliberately say the wrong thing about a picture or a diagram, the vast majority of study subjects brought into that room will simply agree with the 10 Confederates because they don't want to contradict the other people. So what I'm saying is it takes a guy with strong confidence and knowledge and what he's doing is right to stand up to all that peer pressure. Okay, here's a page from Dr. Mcdougall's website, and he's got all these star Mcdougallers. And the reason I show this, these are all people cured from chronic diseases. He's got over 20 pages of people just testimonials of being cured from chronic disease. And the reason this is so extraordinary is you don't understand the regular public. Regular doctors don't have this. They never cure any of these diseases. None of them. Zero. Okay? Now, this is extraordinary. And the first doc I saw who had all this stuff was Mcdougall, but then I learned about Kempner, and Kempner had something similar. Kempner saw 19,000 patients in his Rice Clinic over in Durham, North Carolina, and he had incredible reviews, incredible outcomes, incredible, the best ever in the world. All right, and then Mcdougall saw 12,000 patients in his clinic and whatnot, but I said to myself, you know what, who's the best doctor? Okay, if you want to talk about who's the best doctor, if you go to a private practice hospital, to them, the best doctor is a doctor who makes the most money. Like when I first was in private practice, I one time had this case where a cardiologist and myself had to help out in the care of a patient, and the cardiologist totally screwed up the case. Totally stupid, okay? And I had come, from Harvard. I was used to high standards in cardiology in terms of interventional cardiology. And I'm like, this guy's an idiot. He screwed up this case. I said that to one of the other docs at that hospital. And he goes, no. He goes, you can never criticize cardiology. I go, what do you mean I can't criticize cardiology? I'm just telling you what happened with the case. And he goes, no, you can't ever do that. The cardiology service at this hospital, they bring in more money by far than any other department at this hospital. You could never criticize them. If management ever finds out you criticize cardiology, they'll go after you, not after the cardiologist. So you better keep your mouth shut. And I'm like, oh, wow, I was new. That was new to me. In a university setting, like a big research university, the most prestigious doctor in the hospital is the one who publishes the most paper. The most research papers. And the reason I'm telling you this is because the patient doesn't understand how the doctors are thinking and the hospitals are thinking. The patient's thinking the best doctor is the one who can cure me of my disease, the one who can help me of my disease. And that's what I'm trying to point out here. From a patient's point of view, the best doctor that ever lived is Mcdougall. Because even though Kempner saw more patients in a direct hospital setting, Dr. Mcdougall, through his books as well as his YouTube videos and his newsletters, he helped a lot more patients, cured more patients than Kempner. The most in the world. There it is. And by the way, I briefly was a patient of Dr. Mcdougall's in the sense that I had gotten fat in my 30s, because I was doing too much at once. I was doing 2 fellowships simultaneously, had a wife at home, had a baby at home with the wife, and I authored a textbook during my fellowship year. And so I got into drinking 7 cups of coffee a day. I got fat. I got to 220 pounds, quite fat for me. And then I realized after 3 years I couldn't do it with conventional thinking, exercise more and eat less. That doesn't work. So I started reading all about nutrition, trying to solve my fat problem. My family was loving making fun of me. Hey, fatso, you're going to be a diabetic soon enough. And my wife's like, well, if you become impotent, make my life easier. So I got motivated, and I started reading everything about nutrition. I was gradually figuring it out, but a real turning point for me was when I read, Dr. Mcdougall's ideas about starch being the key thing, and that made sense, that you satisfy your hunger with the fewest number of calories. And then I lost all the weight, and I was actually featured as a star Mcdougall years ago. Okay, and we just talked about this. That's the reason why, by criteria, he's the best doctor who ever lived. Okay, now just a little bit about Dr. Kempner. Now, Dr. Kempner was in Durham, North Carolina, and he would have the patients stay in these rice houses, like little apartment buildings near the hospital there in Duke. And they would have public weigh-ins. If you lost over 100 pounds, you'd be in the Centenarian Club. That would be written on the wall. They would publicly post your blood pressures and whatnot, your body weight. Then they would have the food in that area in the social setting. So the dieters would get to talk to each other, and they like that. And one of the things I want to emphasize is the work of Kempner would have been forgotten. Okay, Kempner's books are available at drmcdougall.com. At his website, he lets you read his book for free. It's highly worth reading. I went over there and read his books. Okay, they're extraordinary. Okay, and he also has the legacy book of Nathan Pritkin. And Dr. Mcdougall said, don't even try to debate nutrition with me until you've at least read the papers of Walter Kempner and Nathan Pritkin. And they're right sitting there. I read Pritkin's other books as well as the final legacy one. It's awesome over at Dr. Mcdougall's website. I read all that stuff in their papers as well. Now, the other thing, too, about Kempner that came up, and this was just a joke. Kempner had a reputation of being a real ladies' man. He's a good-looking guy, a multimillionaire, and I showed this slide. Whoop-de-doo, okay? And it was just a joke. And what I said was, if I was a young guy, senior in medical school, and I had one elective I could do, who would I choose? To go rotate over at with Dr. Mcdougall in California, Santa Rosa, or would I go with Dr. Kempner? And I said, if I was married, I would go work with Dr. Mcdougall. It'd be a stable environment. Dr. Mcdougall and Mary are wonderful role models for a good marriage and stuff. And that's what I would do. But if I was a single guy and I didn't have a girlfriend, you know what? I would want to go to Duke University. It's a college campus, and who knows? Maybe I'd learn something from Dr. Kempner. Okay, that's what that was. Okay, a little joke. Whoop-de-doo. All right, now here is Dr. Kempner and his experience at the Hawaii plantation. So at the Hawaii plantation, right when he finished medical school, he went out and he did an internship, and then he worked as a all-purpose doctor at the sugar plantation in Hawaii. And he saw some extraordinary things. These workers on the plantations were eating old-fashioned traditional diets, like a rice-based diet, for example, sweet potatoes, and traditional plant-based starch foods. Versus the wealthy people in the city, the more educated people, they were getting all the Western diseases. They're fat, hypertensive, diabetic, coronary artery disease, impotence, all the eye diseases, macular degeneration, etc. And not doing so well, and a lot of cancer. And whereas he saw these guys, when they were 65 years old, they would collect a pension. They would then go to the Philippines and get a younger wife, let's say 30 years old or something, and they would raise a whole other family, and they would die in their late 80s, early 90s. And they didn't have any Viagra in those days, okay? So he just saw it. He saw the reality of nutritional health. The person's eating a low-fat, primarily plant-based diet were extraordinarily healthy, okay? Whereas all the westernized ones, his patients, by the way, were patients also from China, Japan, Korea, Philippines, who had sort of moved to Hawaii. And the grandparents were thin and healthy on the old diet. Then their children, the middle generation, was getting fatter and sicker. And then the grandchildren, because they were the most westernized in their diet and habits, were profoundly fat and sick. Okay. And Mcdougall also made the observations that nutrition was almost never mentioned in medical school, residency, and the textbooks. But in his observation, it was the most important thing. So working in Hawaii taught him the truth of health. And it enabled him, once he got patients to follow a plant-based diet, he noticed he all of a sudden started taking them off their pills. Because a typical patient just keeps on getting more pills, more and more pills over the years. Whereas he saw that, a lot of these patients could be cured. And that was an incredible revelation to him. He went to the Hawaii Medical Library, and he saw study after study describing weight loss, relief of chest pain, headaches, arthritis, all owing to a simple solution: a diet based on starch, supplemented by vegetables and fruits. No pills or surgery were needed. Okay, and that's from Dr. Mcdougall's book, Starch Solution. And that's one of the greatest nutrition books ever written. Okay, what are some of Dr. Mcdougall's achievements? All right, he healed more patients than any other doctor in the history of the world, including his books, his videos, his newsletter. His nickname was Dr. Potato. He was an Irish doctor, so it's kind of nice that an Irish doctor learned how to help save the world with potatoes. Potatoes are a unique food. They're relatively complete in their nutrition, as complete as any food in the world. And they have only 1% of calories from fat. So the people who eat them are thin. They're easy to grow. They grow well under harsh conditions. So they are one of the foods that could save the world. Mcdougall said, we are probably going to especially need to eat a lot of potatoes and rice. I want you to remember that statement of his. We are probably going to especially need to eat a lot of potatoes and rice. Okay? Because that's a true statement. And there's persons who contradict that statement. Mcdougall knows a lot more about nutrition than they do, and everything I've read confirms he's right. Okay, he ran a nutrition therapy clinic for decades, took care of 12,000 patients. He knew the nutrition and medical literature better than anyone else, and he told the truth about it. And he kept all these files in his articles in folder cabinets in his basement before his house burned down. He was the best teacher of the internet doctors. He's a fantastic speaker. He'd say things in a very clear way, and you could understand what he was talking about. He educated the public. He had a big clinical practice, later a telehealth practice. His nutrition books are great. His nutrition newsletter is the best one there is. He made great nutrition videos and was great on his radio shows. And he challenged all the big establishment industries, dairy, meat, oil, fast food, processed food, cardiology, cardiac surgery, cancer industry, diabetes, rheumatology with the autoimmune diseases, some of the stuff in neurology. It takes big balls to do that. You don't You don't see doctors doing that. Usually as a doctor, you're tired, exhausted by the time you finish your medical school and residency training. Now it's time to get married and have a kid. You have the kid, you're exhausted from having the kid. You're exhausted from being up late at night with the young ones. And then you're trying to make partner in your group, and you got to bust your ass, take all these night shifts and all these weekend calls. So the last thing in the world they want to do is stir up a fuss by trying to publish a book and contradicting the big power players in the healthcare game. Okay, that's very unusual. Okay, Digestive Tuneup was another book by Dr. Mcdougall. He himself, though, when he was young, he had right lower quadrant pain. They just took him to the operating room, removed his appendix. It was normal, but they said, just to be safe, we're going to remove it. That's how it was in the old days. Nowadays, you got CAT scans, and you could diagnose it from a CT scan. And you could, instead of doing an exploratory laparotomy, potentially ending up with adhesions and bowel obstructions. Okay, we talked about the sugar plantation diet, and then also that knowledge taught him that in his impression, about 80% of disease was due to a bad diet. That's a lot. And given this newfound knowledge about diet and health, he said it became impossible for me to practice medicine the way I'd been taught. I would be a different kind of doctor, one who would empower my patients with the knowledge and ability to truly be well. And like I said, that's like the Don Quixote speech. Mcdougall had to talk to his chief resident and his internal medicine residency physicians, and they're like, what are you doing, man? You just go by the standard of care, prescribe these drugs, you'll make money, everybody's happy. If you don't go down this path, you're going to find it hard to make a living, pal. Mcdougall tells his patients, look around the world and you will notice that the trimmest, healthiest, most youthful people, they live on a plant-based diet that's high in carbohydrates. Look at the Asians that follow diets based on rice and vegetables, okay? Look at the trim people from Peru who eat mostly potatoes. Look at rural Mexico where they live primarily on corn and beans, okay? Those in Africa, they thrive on millet and beans. In New Guinea, sweet potatoes are the mainstay. In the Middle East, chickpeas and rice are the dietary staples. As a matter of fact, anywhere in the world you go, all large populations subsist primarily on a starch-based diet, which starch is also called complex carbohydrates, but starch is easier for people to understand. There's no exceptions, okay? That's what Dr. Mcdougall said, and he's correct. Okay, and then some people say, well, it's because of the exercise. Some of these populations, they exercise a lot. Mcdougall pointed out it's not the exercise, because even the ones with sedentary jobs are thin and healthy where they eat a starch-based diet, okay? And then if you look at a population like the Maasai, for example, and he did a lecture on this, even though they're relatively fit and strong in terms of they walk around a lot with their cattle, they have a tremendous amount of atherosclerosis when they did a research study on them, an autopsy study on them. Okay, and then a lot of other people tell you, well, it's just genetic. Some people have just better genes, and that's why they live longer. Mcdougall says, no, it's not. Look at all the migration studies. For example, look at the Japanese migration studies where they go from Japan to Hawaii. Their health starts decreasing. Then when they go to the USA and they get progressively westernized in their diet, their health just declines furthermore. And it's always like that with all the migration studies, from a plant-based, starch-based, plant-based diet to a more westernized diet, which means more meat, more dairy, and more oils. Okay, Mcdougall says, starch has unlocked the door to good health for thousands of my patients. And that's really what Dr. Mcdougall is. If you had to say one big thing, he is the pioneer standardizer of the concept of a starch-based, plant-based diet. If you look around, you'll hear all these other nutrition experts on the internet and whatnot. You'll almost never hear them say a starch-based, plant-based diet unless they, acknowledge that Mcdougall's the one who figured this all out and made it clear to the public. Okay. This is, again, his quote about there's no exceptions. This is just showing it as, on a map of his slides. Corn in the America, Central America. South America, there's a lot of potato eating that makes people healthy. Sweet potatoes, Papua New Guinea, for example, Okinawa for a while. Beans, millet in Africa and stuff, and wheat in some areas, oats, and in other areas, rice, okay? And there it is. Populations who eat that way, they're skinny and healthy, Before 1970, when China ate close to 90% of their calories from white rice, 1 billion out of 1 billion are skinny. There's no such thing as a fat person. Rice Wank, when he went to China around 1960, They couldn't even find a multiple sclerosis patient. They go, we'll try to find one. Autoimmune disease is so rare in these populations. And white rice has less fiber, but if you're supplementing that with fruits and vegetables, you'll get probably an adequate amount of fiber, depending on the percentages, but probably. Okay, just taking a look here at, this is United States up here, the border here. Here's Pima in Arizona. Here in Mexico, northern Mexico, you got the Tarahumara. They live in the Sierra Madre Mountains, like Copper Canyon area. Sierra means like a saw, up and down edge of the mountaintops. And they stuck with their traditional diet. They can run over 100 miles in 2 days. They're world famous for this. Like every guy in town has got ultra-marathoner ability. And in comparison, here's the Pima in Arizona. In the Mexican-American War in 1848, they separated these populations. The Pima went to Arizona, the Tarahumara stayed in northern Mexico. The Pima have taken on the westernized diet, the SAD diet, standard American diet. Tremendous amounts of obesity, heart disease, hypertension, diabetes, gallbladder disease, etc. Okay, whereas the Tarahumara, they're still able to run 100 miles in 2 days. Nathan Pritkin was so impressed by the Tarahumara, he patterned his Pritkin diet after them. And the reason why I'm going through all this for you as the public is you're going to run into all kinds of people on the internet, for example, and in your personal life, they try to contradict you. They say, well, I heard paleo, keto, carnivore, moderate fat or something was, a better diet for whatever reason. And what I'm trying to say is the epidemiology, you've got these giant sample sets for hundreds of years, and they're irrefutable. You got all these plant-based populations eating a starch-based plant-based diet. They're the healthiest people in the world. And once they switch, like this is an emigration study in a sense, because they were the same population originally. Now they're all fat and sick, okay? And that's how it is over and over and over again. Low-fat vegan always wins. Starch-based always wins. Okay, so here's a Tarahumara ultra-marathoners running, over 100 miles in 2 days. And then here's the Pima, they're like typical Westerners getting surgerized all over the place. The way conventional medicine works is it tries to treat a dietary disease with a pill. So it's drug, more and more drugs, and the drugs don't work so well. So then as they progressively fail and the patient deteriorates, then it's chop, 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 surgery, surgery, surgery. I see patients like this all day long, every day. Open heart surgery, cabbage, coronary artery bypass grafts, cholecystectomy for gallbladder, appendectomy in the right lower quadrant, sigmoid resection over here for diverticulitis, amputations for diabetes, smoking cigarettes, peripheral vascular disease, thyroidectomies for thyroid cancer, on and on all day long, which is often a late sequela of Hashimoto's thyroiditis, autoimmune disease, Graves' thyroiditis. Okay, so anyways, smart move is go down this path. I'd rather be like the Tarahumara than be like the poor Pima. Okay, so I'm showing you these epidemiology arguments because Dr. Mcdougall talks about these. They're a very strong way to refute the other dietary recommendations, okay? And it goes on and on. There's tons of these. I'm just showing you a couple of them. Here's the Yanomamo in South America at the junction of Venezuela and Brazil in the Amazon jungle. They don't have any hypertension. They don't get coronary artery disease. There's a Simani in South America as well. Here's Kenya, for example, in Africa. And there was a study, the Donison study in 1929 in the Lancet Journal, 1,800 consecutive admissions. What percentage of the blacks were hypertensive? In the United States, if you took 1,800 consecutive admissions, the amount of hypertension would be off the charts. Okay. In Kenya, it was zero. There was not a single person hypertension. It ain't genetic. Okay. Okay, the other thing too, there's all this story about, well, people need to drink more milk, they need calcium supplements and all this stuff. Mcdougall says nonsense. There's no such thing as a proven case of calcium deficiency due to lack of dietary intake of calcium. And he also talked about this as, Pritkin talked about this too. The Bantu in Africa, women in South Africa there, they would have 9 children, all right, on average. They would nurse them on average 2 or 3 years. They would have very minimal daily calcium intake, about 350 milligrams per day, and they wouldn't have any calcium deficiency osteoporosis problems. Okay, here's just more epidemiology. It goes on and on. Look at the 7-day Adventists. They got the longest lived lifespans out of any population. The ones that were vegan, the women on average in this group had a lifespan of 88.6 years. The men are about 3 years less than that, 85.3. Dr. Mcdougall had worked with this population, and what he said was that in reality, these vegans were, somewhat religious-based veganism with Seventh-day Adventists. He says they weren't as healthy as they might have been, so he imagined that really the average longevity would be higher than 88.6 years if a person also had, a truly optimal vegan diet, he also pointed out that, let's see, what else? Well, they were healthier there, the Okinawa. Okay, so it's all more of the same stuff. The migration studies, it all says the same thing. And there's studies like this over and over. I don't even want to bore you with them because they're endless. There's tons of them. One last one that I'll tell you because it's a good one, kind of related, is in Finland. They had very high cardiovascular mortality from their high-fat diets. And Pekka Puska was the leader of their project over there to reduce the amount of dietary fat, stop smoking cigarettes, get the wives to cook better meals for their families. And they dropped the cardiovascular mortality quite rapidly by 84%. That's an incredible drop in cardiovascular mortality. The highest you could get would be 100% drop. I mean, 84% drop in mortality. It's extraordinary. Okay, Roy Swank also looked at Norway, for example, and what he saw was in the center of Norway, where they had the dairy industry, they had really high amounts of multiple sclerosis. In the coastal areas, where they didn't drink much dairy, they had very low incidence of MS. And the relevance of that is people sometimes make the argument the further north you go, farther from the equator, the more autoimmune disease you have. And some people will say, well, that's because of the amount of sunshine, it's a vitamin D issue. But what Swank was saying was, no, no, no. And the reason why Roy Swank is so important, he's one of the important mentors of Dr. Mcdougall. What Roy Swank said, no, no, no. It's not a question of latitude and sunshine because somebody in central Norway right here will have the same amount of sun exposure as somebody on the coastal area. But there was a big difference in the MS incidence, coastal area versus central Norway dairy area. And it's the dairy. It's not the sunshine as the main thing causing autoimmune disease with specific reference to multiple sclerosis. So that was an important observation. Oh, another big observation came out of the rationing studies in World War II. World War II was a very stressful time for a lot of people in Europe. And the displaced refugees, despite the incredible psychological stress, were still healthier than the pre-war populations were because the pre-war populations were eating high-fat diets. So the point of what I'm saying here is stress is a big deal, and excessive stress can worsen health, but diet's more important than stress. And that's good to know. That's useful to know. Okay, so here is, why is starch so great for improving people's health? And the reason is when you eat the starch, it's low caloric density. Starch is like about only 1 calorie per gram versus the amount of calories in fats, like 9 calories per serving. So what I'm saying is you get much more distension of the stomach with the starch being low caloric density than you do with the fat. And then that glucose comes out of the stomach. Once it comes out of the stomach, it's still wrapped in fiber, so the enzymes have to peel the fiber off, and it's slowly absorbed from the stomach into the blood. And it has the effect of a slow-release energy pill. That's the benefit of eating starch. Stretches your stomach, and then it's slowly absorbed. So you satisfy your hunger with the fewest number of calories, and you end up being skinnier. Here's typical starches: potatoes, sweet potatoes, rice, beans like quinoa, quinoa, oatmeal, peas, lentils, garbanzos. Okay, and potatoes, sweet potatoes, and white rice, they all have only 1% of calories from fat. So that person who eats the bulk of their calories from that, they're likely going to be relatively thin towards their optimal body weight. And you can look at the beans. Lentils have about 3% of calories from fat. Garbanzos got about 13% of calories from fat. Black beans about 4% of calories from fat. So if you want to lose weight, Mcdougall's pointing this out. The fat you eat is the fat you wear. Lower the percentage of your calories from fat, and you're likely to improve your weight. Okay, here is like after you eat a starch, your blood glucose curve. It's going to go up a little bit, and then it's going to stay in the normal zone for a prolonged amount of time. If you eat simple sugars, you tend to spike your blood glucose more rapidly. The pancreas overcompensates. It's confused by that. There's not that many high simple sugar foods in nature, and you'll have a tendency to drive your blood glucose down rapidly. You can get rebound hypoglycemia from that. Okay, here's a little bit more detail on these postprandial. Prandial means eating. Postprandial blood glucose curves. So we talked about if you eat something with excessive amounts of simple sugars, you spike your blood glucose level rapidly, and then the pancreas overcompensates, and you're vulnerable to rebound hypoglycemia, where your blood glucose can drop too low. Then you get this lousy feeling. You want to drink and eat something sweet real fast, and then it goes back up again, and you end up with a roller coaster blood glucose curve, and you get fat. That's one way that simple sugars have the potential to make somebody fat. Okay, but here's another thing, a little more complex, but it's more important to know. And by the way, the green line is the starch again. It keeps you in the zone a prolonged amount of time, the golden mean, the Goldilocks zone. You feel good, your hunger's satisfied. It satisfies hunger the best. Okay, IR means insulin resistance. And this is the question of carbohydrate intolerance. So what happens if you eat a high-fat meal, the fat gets into the skeletal muscle faster than the glucose does. So I'm looking at this red line here. And once the fat gets into the skeletal muscle, it causes insulin resistance. It actually inhibits mitochondrial complex 3, and that leads to what's called overnutrition and insulin resistance. In Dr. Mcdougall's word, fat paralyzes the insulin receptor. And once that happens, then the body can't get glucose into the blood, can't take glucose from the blood into the muscle. Because normally most of your postprandial glucose is going to go to your skeletal muscle to be stored as glycogen. Skeletal muscle is like the biggest organ in the body, so it stores a tremendous amount of glucose and glycogen. And the point is, when you've eaten the fat meal, it's inhibiting the ability of the muscle to take up the glucose. So that's called insulin resistance. The insulin is not working as it should. And so they have prolonged high blood glucose levels. And it's bad to have prolonged high blood glucose levels because there are certain cells in the body, like endothelial cells, arterial lining cells, that are constitutive, meaning they take up whatever amount of glucose is in the blood. So if it stays elevated a prolonged amount of time, then they take up too much glucose, and that injures those cells. Okay, what are some other things Dr. Mcdougall did? He provided a systematic way to understand health. He made sense out of things. He had mentioned when he was a resident that nothing sort of made sense. He followed recommendations, did what he was told, went with the standard of care, but he didn't understand what caused any of the diseases, and he certainly knew that we didn't know how to treat them well. These pills weren't working. But then he saw from Dentist Burket how to make sense out of the abdomen. So he started studying all the literature, Dr. Mcdougall, as well as the great ones like Kempner and Swank and later Pritkin, and he figured out a rational way to make sense of everything. Starch is at the center of everything. And I would tell you this too, I've been a doctor over 30 years, first in my class, all that stuff, and loved biochemistry, which we were told was our nutrition component. None of this is in those books. There is close to zero training in nutrition, epidemiology, and toxicology in medical schools. And what Mcdougall's saying here and what he learned is that you can't understand these diseases or make sense of them unless you know nutrition and epidemiology, okay? And so once he got the idea of eating starches was the secret, as they're the best way to satisfy hunger, they taste good, they're comfort foods, and they end up making you look good, skinny and healthy. That was the big secret. And then he just explored that in depth and found that you can support it in numerous ways. It's intellectually consistent. It's logically consistent. The rationale fits. It works. Epidemiology shows it creates the healthiest population. And epidemiology is important. If you listen to the paleo, keto, carnivore videos and hear them talk, they're always going to say epidemiology is worthless. The reason why they say that is because it totally shows that they are wrong. I mean, that's about, you want a big sample set, in some randomized controlled trial, you'd be happy if you had 50 patients, okay? With these epidemiology studies, you got billions, okay? Billions of rice eaters can't be wrong, okay? They're skinny. All right, you got all these other populations, sweet potato eaters, regular potato eaters, they're skinny and healthy. Okay, so you got the epidemiology studies, which are very powerful. You got the migration studies. Whenever people migrate towards Western diets, they get fat and sick. When they eat their old traditional plant-based diets, they're skinny and healthy. Okay, the research by individual doctors and nutrition experts like Kempner, Burket, Blankenhorn showed whatever type of fat you eat, it doesn't matter which type of fat, they all increase atherosclerosis. The way to reduce atherosclerosis is reduce dietary fat. That's an important point because atherosclerosis is the most common thing that kills people. And it's not just heart attacks, coronary artery disease. It's also the fact that it makes tissues ischemic tissues, meaning having a lack of oxygen delivery because of the atherosclerosis blockages and narrowing of arteries. They get more cancer. Okay, they both go together. And I'll actually make an argument. We don't have time to go into it all, but they weaken the immune system. That's a topic for another day, but I'm just letting you know all of it pushes in the same direction. There's something called consilience. Consilience means that you could have 1, 2, 3, 4, 5 minor supports of a major conclusion. And each of the 5 little things by themselves might not be so strong, but you add up those 5 things and you get another 5 of them. All of a sudden you've got 10 small weighted factors all saying the same thing. And that's what happens with veganism. You're like, well, gee, this supports it, and 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 this, and this, and this, and study after study. So it's overwhelming. It's irrefutable. I mean, like I said, the most important thing I ever learned in my entire 30 years of education, over 30 years of education, I've been a doctor over 30 years, is that starch is the secret of keeping a population healthy. Mcdougall figured it out, and he explained it in great detail, and he showed why it is correct and how it's all consistent, okay? And that's the most important thing you'll ever learn about health. What else? So besides the research of all these great scientists, including Dr. T. Colin Campbell, Swank, and others, the longevity studies show it's the best. Okay, the comparative anatomy, like chimps are almost purely vegetarian. They do eat some small monkeys. They're more fruit-based, we're more starch-based, but that also shows that starch-based diet is the way to go. And that also shows they provided more than enough calories for brain development. Okay, the military histories, let's say of Alexander the Great or Julius Caesar, gladiators, Genghis Khan, they fought best on a plant-based diet. Okay, the Roman soldiers, their diet was typically to work all day and then to eat their food at night. That's almost like a version of the OMAD diet, 1 meal a day diet. Okay, McDougall did a study of the gladiators, and they were called the barley men. They fought best and were most fit, able to compete, eating a plant-based, starch-based diet. Okay, if you look at the paleontology studies, and you look at the Egyptian mummies, they, the ones who were eating the rich modern diet with a lot of high-fat foods, a lot of animal foods, they had modern Western diseases. They had atherosclerosis. You see their aortas are all calcified, gallstones, obesity. Okay, and there's been additional paleontology studies, like looking at human origins. In Europe, they did a bunch of construction products where they would have to dig up old graveyards, and they found that the aristocrats, where they were eating lots of high-fat foods, they would have what's called DISH, diffuse idiopathic skeletal hyperostosis of their spines, which is associated with obesity, hypertension, and diabetes, versus, the peasant population graveyards, when they're dug up, hardly any of that stuff, because they're eating more plant-based diets and they don't have all that fat. Okay, his own personal experience from taking care of all his patients and his own personal health for himself and his family, it all works. The anatomy works, the epidemiology works, the physiology works, the biochemistry fits, the molecular biology. It's the way to go. Okay, here's two of Dr. Mcdougall's great books, the Digestive tuneup, going from the mouth all the way down into the rectum, everything that's happening in the digestive tract. Very clear book, very nicely illustrated. Here's the book, Starch Solution, one of the best books ever written. They're both excellent books. They're both some of the best books ever written in nutrition and health. Okay, here's something about the Starch Solution by Dr. John Mcdougall. 75% of disease. So I've heard him sometimes say 75% and other times 80%. So it depends how you're looking at the data. But basically 75 to 80% of disease in industrialized countries is chronic disease like obesity, hypertension, coronary artery disease, diabetes, arthritis, and cancer. And what do these people have in common? A diet dominated by meat, dairy, and processed food. For a disease to progress, injury must outpace healing. For healing to occur, healing must outpace ongoing injury. Okay? If an injury goes on too long, it will eventually do irreversible damage. The body is always trying to heal. That's an important line. The body is always trying to heal. It does not stop, not even for 1 second. You just got to let it heal. Get out of the way by eating the right diet. Okay, so Dr. Mcdougall goes on. He saw a young man in Hawaii. He said, during my early years in Hawaii, a young man was mangled by a motorcycle accident. He had many broken ribs and a skull fracture. His left thigh had a comminuted open fracture. So that means the femur, the big bone in the thigh, was broken into multiple parts. That's what comminuted means. Open means that the bone's sticking out through the skin. There were numerous superficial lacerations. Within a week, he was up and walking on crutches. After 3 months, he was walking on his own without a limp. If the body can heal from this massive assault, then it can heal from almost anything. Okay, he also had the fortunate experience to get to work a little bit with Dr. Dennis Burket. In 1971, when he was a senior resident in internal medicine, he went to the routine noontime conference, and Dr. Burket was giving his lecture. He said, America is a constipated nation. If you have small bowel movements, you need big hospital. If you have big bowel movements, you need small hospitals. Okay, I'll show you a picture of that in a moment. The key to big bowel movements is to increase the amount of dietary fiber. And McDougall says, this was the first doctor, Dr. Burket, who ever told me that diet and health were directly related. Okay, that the foods we consume cause the majority of our common chronic diseases. Burket, working in Uganda, he noticed that the meat and dairy eating Westerners, American types, only had 4 ounces of stool per day, versus the Africans eating a plant-based diet would have about 16 ounces of stool per day. Dr. Burket was a rather interesting character. He would go around collecting stool specimens from humans. He had some other doctors, epidemiology experts and whatnot, nutrition experts, who were helping him to figure out what was going on. Why was this population so healthy and these other ones so sick? He was in charge of the epidemiology for like most of the hospitals in Africa. It's a lot of hospitals, okay? And Burket continues, among the plant-eating Africans in Uganda, there was 0 people with type 2 diabetes. No one was fat. 0 obese patients. 0 appendicitis. 0 diverticulitis. 0 inflammatory bowel disease, ulcerative colitis, and Crohn's. No one had dental caries, varicose veins, or hemorrhoids, or HH, hiatal hernia, which is associated with GERD, gastroesophageal reflux disease. He had only 1 case of gallstones in 20 years. Only 1 heart attack patient, which was a judge who had recently returned home from London where he was eating a lot of beef. Burket said, the frying pan is something you should give your enemy. Food should not be prepared in fat. Actually, remember that line. The frying pan should be something you give your enemy. Remember that when somebody tells you to eat a high-fat food, what are they really saying to you? Food should not be prepared in fat. Our bodies are adapted to a Stone Age diet of roots and vegetables. The book goes into the pathophysiology. Then this is Digestive tuneup. Goes into the pathophysiology of appendicitis, diverticulitis, hemorrhoids, and all this stuff, varicose veins. Okay, Dennis Burket said, diseases can rarely be eliminated through early diagnosis or good treatment, but prevention can eliminate disease. If people are constantly falling off a cliff, you could place ambulances at the bottom of the cliff. Wouldn't it be better to build a fence at the top? If the water's overflowing, wouldn't it be better to turn off the faucet rather than just keep on trying to mop up the floor? And Dennis Burket concluded, the only way we're ever going to be healthy again is if we go back to the diets of our ancestors, plant-based diets with very higher amounts of fiber. Dennis Burket said that, humans, our ancestors ate probably over 100 grams a day of fiber. We really should be eating at least 50. Average American's only eating around 12. So there's Dennis Burket. Dr. Mcdougall has a very unique interview with him on his YouTube channel. That's the only one on the internet as far as anyone's aware of. So there was the old man, Irish Christian missionary to Africa, teaching the world about what he'd learned. One of the great mentors of health. And one of the points I want to make about him is that Dr. Mcdougall saved his legacy. If it wasn't for Dr. Mcdougall, Burket would be forgotten. And people might say, oh, you're exaggerating. No, I'm telling you, I know the medical books backwards and forwards. There's no mention of Dr. Burket other than where they talk about Burket's lymphoma, because he also figured out a pattern of a disease of cancer called Burket's lymphoma. But other than that, they don't mention anything about abdominal pressure syndrome, okay? This information is lost on the public. The work of Dr. Kempner, it would be lost, okay? Dr. Mcdougall preserved the work of Kempner, Burket, Swank, Pritkin, and he's preserved it on his YouTube channel. He's preserved it on his website. He's preserved it in his books. This information would other disappear from the public, okay? And they would not know. The conventional medical system doesn't want anybody to know about these people. You go into the cardiovascular pathophysiology books, there is no mention of Dr. Esselstyn. You read in the oncology textbooks, there is no mention of T. Colin Campbell. So the most important scientists, the best ones who ever lived, who did the most to help mankind, they are not in any of the books. It's very easy for their legacy to disappear and slip away. So it's the responsibility of us who are lucky enough to know about it to try to preserve it. Okay, here's a slide that Dr. Mcdougall is showing that, from the work of Dennis Burket and whatnot that he learned. What Burket said, if you have small stools because you're constipated from a lack of dietary fiber, the people are very sick and need big hospitals. If you eat a lot of dietary fiber from a plant-based, starch-based diet, you'll have bigger stools and you won't really need much of hospitals. This is a picture showing the work of Dennis Burket. Basically, fiber adds water to the stool, so it makes it soft. When you got soft stool, it kind of moves around through the colon. The colon's shaped like a question mark, goes up like this. There's a ascending colon, transverse colon, descending colon, sigmoid, and then the rectum, okay? Normally you'll have this watery, soft stool, goes into your rectum, it stretches it, and that causes a reflex to defecate when you're at a safe moment, when you're home, not when you're driving in your car. Okay, but you have your bowel movement, and it comes out almost effortlessly. Zoop! All right, whereas if you eat a low-fiber diet, the stool becomes dried out on the right side. You can form appendical lith. Lith means stone. Feces is feces, so fecalith means stone out of feces. The fecalith can block the appendix. The appendix has mucus-secreting glands distal to that. They try to push the mucus past the appendical lith. It can't get past, so the gland swells and it pops. That's appendicitis, okay? When you defecate, if you're trying to, push out goat pellets, so a normal bowel movement should be soft, almost like a cow patty, okay? And it should not be hard like a goat pellet. If you're pushing out goat pellets, they don't stretch the rectum, so it's harder for the rectum to push them out. And the person strains to the stool. They tighten up their abdominal muscles. That's called the Valsalva maneuver. That increases back pressure into the abdomen. The increased back pressure in the abdomen will push the stomach up into the chest. That's called hiatal hernia, HH, because this is a diaphragmatic hiatus. That predisposes people to gastroesophageal reflux, increases the patency, it makes it incompetent, the lower esophageal sphincter right here. And that reflux, acidic reflux, will increase the risk of Barrett's esophagus, heartburn-like pain behind the sternum, the breastbone, and increase the risk of esophageal cancer. It's become so common. When I was a young guy, smoker-drinker cancer was more common, like a squamous cell. Nowadays, it's adenocarcinoma is more common from all the reflux disease, from all these people eating the high-fat diets, low in fiber. Okay, the back pressure, straining at the stool, defecation will increase diverticulosis, outpouches in the wall of the sigmoid. Some of those will pop, give you diverticulitis. Okay, the down pressure, the same pressure, makes the veins in the rectum bulge, rectal hemorrhoids. It can cause back pressure down into the veins of the scrotum, and you get, that's called a varicocele. That heats up the testicles, lowers testosterone production, lowers sperm production. So yes, it's true. A lack of dietary fiber from being constipated can make a man infertile with these varicoceles. The back pressure pushes down into the veins of the legs, and that will cause varicose veins. So there's your big secret about varicose veins. And that's, together, those things are called abdominal pressure syndrome. Oh, I just added a few little things here. The lower esophageal sphincter also becomes incompetent with gastroesophageal reflux and hiatal hernia. In a lot of patients, then they get heartburn symptoms, and that can then reflux up into higher up. It can cause hoarseness of voice, affecting the larynx. It can increase your risk of sinusitis. It can increase your risk of asthma as well. It can get into the lungs a little bit, the reflux. Okay, you'll have increased amount of HP. HP is Helicobacter pylori, causing peptic ulcer disease. Okay, and so you eat the plant-based diet, you get less symptomatic Helicobacter pylori. Okay, and then the high-fat diets also cause higher levels of cholesterol, and gallstones are typically precipitation of excessive cholesterol within the bile. Okay, so they're like 95% of them are cholesterol gallstones. So anyways, this is all the stuff associated with abdominal pressure syndrome from the work of Dr. Burket and also Dr. Mcdougall's insights into it. Okay, here is Nathan Pritkin. Nathan Pritkin was a genius. Nathan Pritkin was a guy who started studying nutrition to save his own life. He had severe coronary artery disease when he was a young man, in his early middle age, around 40 years of age. And so he went through all the literature. It's extraordinary. And his book, his legacy book, is on Dr. Mcdougall's website at drmcdougall.com. And Dr. Nathan Pritkin says, look, the way you can distinguish the different diets is by the amount of fat they eat. And he studied all the different types of fat, MUFA, PUFA. So MUFA is monounsaturated fatty acid, 1 double bond. PUFA is polyunsaturated fatty acid, 2 or more double bonds. Sat fat means saturated fat with no double bonds. Okay. And the conclusion he came to is fat is bad. The more fat, the worse the health of the population. Nathan Pritkin described dietary fat as lipotoxicity, and he basically said it's impossible to be too low in fat. You can have populations where they fed them controlled diets for a prolonged amount of time, less than 1% of calories from fat, and those patients did very well. People who were starving, you could feed them very low amounts of fat, and they'll do well. People do well on very low-fat diets. It's impossible on any naturally chosen diet to be too low in fat. That's an important statement. He also came to the conclusion it's impossible to be too low in protein. Actually, an optimized diet is relatively low in protein. An optimized plant-based diet is in the ballpark for most people of around 80-10-10. 80% starch, complex carbohydrates, about then 10% of protein, 10% of fat, approximately, or even a little lower in the protein and fat than that. But just those are good ballpark numbers. And the main way to differentiate these diets is by the amount of fat. Dr. Mcdougall said that the main toxin in the Western diet is the high amounts of fat. They both agreed that the high amounts of fat were the main thing causing hypertension, the main thing making people fat, the main thing leading to atherosclerosis. Okay, just one point I want to make about diabetes. You know, Dr. Mcdougall points out that the fat paralyzes the insulin receptor. And there's a paper about the way in which fat gets into the skeletal muscle cell. They used to think it was a transporter, like CD36 transporter of fatty acids. But it turns out, even if you inhibit all the fatty acid transporters that are known in the plasma membrane, the fat still gets into the skeletal muscle cell. And it appears what's happening is something called the flip-flop maneuver. Here's the paper. You can see it. Anthony J., James Hamilton, 2020, putative inhibitors of fatty acid transport across membranes. Okay, so anyways, they would get into the cell in proportion to the amount that was in the blood. So it's a constitutive thing that the more fat you got in the blood, the more fat is going to get into these skeletal muscles. Okay, and they get there before the glucose does, and then they cause problems for the mitochondria, leading to insulin resistance. So what I'm saying is you're not going to win that game unless you reduce dietary fat. Okay, now here is... And it's another point is you don't say I'm trying to control things with pills. That's what a stupid person says. A smart person says I'm trying to become a low-fat vegan so I can hopefully cure these diseases. Type 2 diabetes, Dr. Mcdougall says it's always curable with a low-fat vegan diet. Fat first begins to accumulate unhealthy pathological fat in the skeletal muscles, and that causes postprandial hyperglycemia. Prandial means eating, so that causes insulin resistance at the time of eating, so then you get prolonged high blood glucose, and that's postprandial high blood glucose, hyperglycemia. The fat progressively then accumulates in the liver, and now the liver can no longer accurately sense blood glucose levels, and it'll keep releasing glucose into the blood even when it shouldn't. So then you'll have fasting hyperglycemia. And then the fat starts accumulating in the pancreas, okay? And that damages the pancreatic beta cells, the islet cells, and they lose the ability to produce insulin. And then you're stuck. Then you've developed irreversible diabetes once you've lost too many of your beta islet insulin-producing cells, okay? This has also been called the ectopic fat theory of, like, Gerald Shellman. He's this MD, PhD researcher at Yale, and they've now shown definitively with nuclear magnetic resonance spectroscopy that accumulation of fat in skeletal muscles is the first detectable finding of insulin resistance. So that's a big statement. Diabetes is a fat disease. So people who actually studied it in great detail, and by the way, Roy Taylor also worked with him on nuclear magnetic resonance spectroscopy, and also he did the liver studies to show you can see once you can get the fatty liver to go away by getting these patients to lose weight, their type 2 diabetes was cured. If you catch them like less than 4 years, you had like 100% of his patients with type 2 diabetes less than 4 years be cured once they lost the weight and resolved their fatty liver. So, because most people say, oh, sugar diabetes, it's due to eating sugar. No, it's due to fat. The hyperglycemia is a symptom of the underlying problem, which is typically too much dietary fat. That's the main cause of insulin resistance. There's some less important causes of insulin resistance due to, harmful chemicals and stuff. We're not going to get into that right now, but the most important thing is the dietary fat. That's the big turning point issue in diabetes and insulin resistance. Okay, I was interested in mitochondrial inhibitors, and I looked at all my biochemistry books. I own about 7 of them, and I couldn't find anything on mitochondrial inhibitors. Okay, this stuff's not in the books. Fat inhibiting complex 3 and these other problems here. It's not in the books. But then I started going through the literature. I quickly found over 50 mitochondrial inhibitors. But the important thing to know is dietary fat inhibits complex 3, and then you get a backup of electron transport. This is the inner mitochondrial membrane. Typically, electrons are handed off like a fireman bucket brigade from complex 1 all the way to complex 4, which are progressively stronger as you move down the path. Stronger grabbers of electron, if you will. And then oxygen is the ultimate electron acceptor. You need oxygen to run electron transport inside your mitochondria. And this is relevant because this is life on Earth. Multicellular organisms, the vast majority of their energy, over 80% of it's produced in these mitochondria. And this is how it all happens. And that's why you need oxygen. You cannot run this without oxygen. And if you can't make energy from oxygen-related oxidative phosphorylation metabolism, you're going to be running anaerobic glycolysis in the cytoplasm, and that doesn't work so well. That doesn't give enough energy to be a multicellular organism. Okay, so here's a big quote by Dr. Mcdougall, one of the ones he's famous for. The fat you eat is the fat you wear. Okay? And here's Dr. Mcdougall's quote. Excess fat is the biggest toxin in the Western diet. That's an important statement. Excess fat is the biggest toxin in the Western diet. His mentor, Nathan Pritkin, said, fat is bad. His other mentor, Roy Swank, says, you want to prevent multiple sclerosis, prevent these patients from getting worse, you need to reduce dietary fat. Okay? What did Kempner do? He got dietary fat down to incredibly low amounts, less than 10%. Burket, eat more starch, which reduces dietary fat. And I heard a quote, and this is something I added since I gave this presentation initially. I just added the slide because I saw this quote from Shakespeare. The quality of mercy is not strained. It droppeth as the gentle rain from heaven. Upon the place beneath, it is twice blessed. It blesses him that gives, and it blesses him that takes. Okay, by Shakespeare. Okay, so that's beautiful about mercy being double good. And starch is double, triple, quadruple good in multiple ways, okay? And mercy was brought into the world on a large scale by Christianity. The best novel ever written was Quo Vadis, one of the best novels ever written, Quo Vadis, comparing the ancient Romans to the early Christians, okay? But besides all that, as soon as I saw the Shakespeare quote, it made me think of what about fat? Because there's a lot of people on the internet trying to say, oh, fat is good and there's good fats and all that stuff. I'm going to tell you, the quality of fat is 10 times damned for human health. Number one, the higher the amount of fat, like Dr. Mcdougall said, the fat you eat, the fat you wear. The higher the percentage of calories for fat, the more fat the people are. It's an obesogen, like Genesis, to cause. It causes people to become fat. It's a presogen. I just made up this word presogen, and I'm using it to say it causes hypertension because it makes people hypertensive. It sticks the red blood cells together. There's a very nice movie about that from the work of Swank that's on Dr. Mcdougall's YouTube channel. It's called High Fat Meal and Blood Sludge. It sticks the red blood cells together. Now you're pumping. Why do you have a blood pressure? To pump blood to your cerebral cortex on the top of your brain. So if your heart is pumping regular blood, it's like water. It's relatively easy to pump it up there. Your pressure will be something like 110/70. But if you're pumping thick blood, because it's like a milkshake, because the fat's sticking everything together, your pressure is going to go higher. All right, it's a diabetogen. It causes diabetes. It's the cause of insulin resistance, the main cause by far of insulin resistance. So it's a diabetogen. It's an atherogen. It increases the risk of atherosclerosis. It sticks all the red blood cells together, so it's a thrombogen. It also causes activation of the neutrophils, and they release something called myeloperoxidase, MPO, which is cationic, positively charged. It interacts with the negatively charged glycocalyx, sugar coating, so to speak, of glycoproteins on the surface of all the endothelium, the arterial lining cells, and it collapses the antithrombotic component and exposes the prothrombotic component. So what I'm trying to say is it's markedly thrombotic. It also, a diet, the higher you are in fat, typically the lower you're going to be in fiber. A low fiber, high fat diet increases intestinal permeability. Increased intestinal permeability is called leaky gut. When you get leaky gut, you get the bacterial gram-negative LPS, gram-positive LTA, lipoteichoic acid. LPS is lipopolysaccharide. They get into the blood more, and they're prothrombotic. So I'm just explaining, that's one of the things that I have the experience of is, more experience with biochemistry and molecular biology, that it works. The closer you look at the biochemistry and the molecular biology, the more you see that this low-fat starch diet is the way to go. So that becomes prothrombotic, the whole amyloidogenic clotting stuff, and especially popularized by the work of the research scientists Douglas Kell from England and Etheresia Pretorius from South Africa. Okay, also the same things that cause leaky gut, guess what? They cause leaky blood-brain barrier. Leaky blood-brain barrier. The brain has to normally maintain tight junctions between its individual endothelial cells so you don't get toxins into your brain. Think about it after you eat a meal. All kinds of stuff raises in its level in the blood, but you need a tight blood-brain barrier so you don't get any of that into your brain, because the brain cells, they need a very precise ionic milieu, microenvironment to run all their action potentials. If you have a leaky blood-brain barrier, you're going to have brain fog, difficulty concentrating. How many people have that? Lots of them. Okay, what else does the high-fat, low-fiber diet have? It causes abdominal pressure syndrome because you don't have the fiber to maintain the bulk of the stool, to pull water into the stool. So you get all this abdominal pressure syndrome like Burket talked about. When you have all this atherosclerosis, plus you have increased activation of mTOR, insulin resistance leads to increased insulin-like growth factor, leads to increased mTOR activation. That speeds the rates of cell replication, meaning that for cancer cells, it speeds up their rate of growth. I forgot to put it in here. Excessive dietary fat also inhibits the immune system. It suppresses immune system function. There's a lady, a Harvard immunologist. Her name is Lydia Lynch. I think she's moving to Princeton now, her group. But she did some brilliant work showing that when the mice are fat, their immune system is suppressed. You get some fatty spillover, leakage of free fatty acids into the blood with obesity, but also from high fat meals. You get suppression of the immune system, like the NK cells, the cytotoxic T cells, and they're not able to remove the cancer cells. They're less able to fight infections. So what I'm saying is you make yourself more vulnerable to infection, you make yourself more vulnerable to cancer, and the high-fat eating populations, they die sooner. This is the big deal. What I'm trying to say is there's overwhelming mountains of data to support the idea that people should eat low-fat diets. And Mcdougall pioneered understanding of a lot of those concepts, okay? And then I talked about the different categories of diet, and this is how I see it, okay? And I think this is correct. I think anybody who looks objectively at it will see it the same way. There's old-fashioned Walter Kempner white rice diet, okay? He used to feed the patients white rice, Uncle Ben's rice, okay? And he wanted it to be very low in protein and very low in fat because that protects kidney function and that prevents hypertension. He was mostly treating those two categories of patients. Kidney failure patients who used to just die in those days because they didn't have any dialysis, and hypertensive patients. There were no good drugs in that day. They would do these major surgeries, sympathectomies, which didn't work so great. Okay, and Dr. Mcdougall called Kempner's diet the diet for the nearly dead. Okay, they'd also give him some fruits. And there was some calorie restriction in some of the components there, especially if they were fat. Okay, then there's also the fruitarian types, like Michael Arnstein's the famous ultramarathoner. Ruth Hydrett started out on the Mcdougall diet for a couple decades, and then she gradually moved towards eating a lot more raw fruits and whatnot. She's out in Hawaii. They're more available than they are to people elsewhere, and it was convenient for her. But there's even a school of raw is the law is how they're thinking about their diets, okay? And then there is the raw till 4. And this sort of came out of a work of Durian Ryder. And it's kind of funny. Durian Ryder, well, I'm not even going to talk anymore about Durian Ryder and Freely the Banana Girl. But if you're interested, they were a hot couple in the vegan world, okay? And then Garth Davis, he is a sort of a famous bariatric surgeon. He wrote a great book called Proteinaholic, and he just made the comment that in his experience, these fruitarians, because he competed in triathlon races and stuff, were extraordinarily healthy. So I think that's under-recognized, some of the benefits of fruit. But fruit's a little bit of a complex, big subject. We're not going to get into it right now. But I'm showing you the dietary categories. And then there's myself, and my diet version has been called Spartan Vegan or Medical Monk. I've kind of been called Bad Boy of Veganism because I talk about toxicology and things people don't want to talk about. But it's a little bit more restricted than most people want to do in EMF and all that stuff. So I'm kind of also kind of out there, okay? And then there's more of a middle-of-the-road approach to nutrition. I would call this the California School of Nutrition, and it's really the Dr. Mcdougall School of Nutrition, okay? And there's a lot of people in this category. And I jokingly at the top of it put vegan extremism because of that Wikipedia article, but that's ridiculous. I actually think this is the most realistic approach for the largest amount of the population. It's doable, okay? And these are a lot of the people that have been associated with the Mcdougall diet and what I would call the California School of Nutrition, okay? I put Esselstyn diet as, close to it, but a little bit separate in the sense that Esselstyn a lot of times had these refractory patients that already had myocardial infarctions and whatnot, and he would emphasize eating lots of greens. He was influenced by Nathan Bryan. He's like the world's best expert on nitric oxide. That the more greens they ate, the more systemic nitric oxide they would produce. As we get older, we produce less nitric oxide. You can also get a lot from sunshine. That's why it feels good when you walk out in the sun. You got subcutaneous precursors of nitric oxide that are activated by sunshine. So those are some things that make people healthy. Getting their sunshine, eating their greens. We're designed to do that. Our ancestors did. And then there's what I would call the moderate to high-fat category. There's a lot of vegan-based diet persons who are recommending omega-3s, recommending olive oil, canola oil, and soy. Soy is a very high-fat food. It's like 40% of calories from fat. I've seen papers saying 37% to 40%, okay? And there's a lot of doctors there, and there are a lot of the most famous ones. There's the ones that are sort of often glorified and said are so great, and a lot of them are fantastic. But I'm just saying, I think this idea of more fat is misguided. That's my opinion based on a lot of study in nutrition. And that's why I hold to this ground, okay? And this, there's publicity in it. There's money in this. There's big money in this. Because if you can sell something, if you can sell omega-3s, if you can sell soy, olive oil, nuts, and seeds, you can make a lot of money. And these corporations, they're billion-dollar corporations. You can get sponsors. You can get promoted. So what I'm saying is you got a much better chance of getting sponsored and promoted if you support this school of nutrition here. But I think from a health point of view, it's a mistake to let dietary levels of fat go up like that. Because what did I just show you? Fat makes people fat. Fat causes hypertension. Fat causes insulin resistance. Fat leads to increased amounts of all these other problems. Omega-3s are associated with suppression of the immune system. They're associated with increased risk of prostate cancer, okay? I don't want those things, okay? Then you start getting into these other schools of nutrition. And these are often like animal rights vegans who, they don't really care so much about their health. They just care about not eating animals. And there's subtypes, lacto-ovo, pesco, vegetarian, so to speak. You got the whole Mediterranean diet. The relevance of the Mediterranean diet is almost all the big universities, almost all of them, everyone that I've ever seen, recommends some variation on the Mediterranean diet, which I think is an incredibly stupid diet, okay? Dr. Esselstyn's diet was compared to in the Lyon study to sort of an optimized version of the Mediterranean diet, and his was more than 30 times better outcomes with regard to cardiovascular disease. And the ones that they're promoting in a lot of these big name universities and hospitals is not even as good as the Lyon version, okay? And paleo low carb, carnivore, all that stuff is for chumps, okay? I mean, if you want to slow down the brain with a ketogenic diet in a patient with refractory seizures, you might have a special case where it might be the cost risk-benefit ratio there might make it worth it in that patient. But for a regular person, why would I want a diet to slow my brain down? Make yourself stupid? That doesn't sound like a good strategy, okay? And that's kind of pioneered by a Harvard psychiatrist because he felt he can calm down some of his anxious patients. Well, my attitude would maybe they're becoming anxious for some other chemicals. We're not going to get into that right now, but I'm just letting you know these are the schools of nutrition. And then there's the SAD diet, which is just a disaster, which, you know, the majority of Americans eat standard American diet, okay? And now I'm just going to tell you what happened. I got somebody a little pissed off at me with this metaphor here. I noticed that big business in general doesn't like vegans because they don't sell stuff as much as Mediterranean diet is much better for selling stuff. So going into that moderate fat category of veganism, that's like the safe spot to be if you're going to be a vegan. Okay, Mediterranean diet's not veganism. That they have them eating chicken and fish and all kinds of things. And I remembered that there was a speech by Malcolm X. Malcolm X had said that he was a field Negro in the sense that he told unpleasant truths and that made a lot of people not like him or pissed off at him, okay? And so then I made a joking comment, and this was removed from a previous True Grit that I give on another site. I made a site that, in a sense, vegans are not accepted by mainstream society. I've had viewers tell me, stop calling yourself a vegan. Everybody thinks vegans are a bunch of weirdos. They think vegans are crazy, that they're a bunch of wimps. And you shouldn't use that word. You'll never have people accept your advice if you use the word vegans. Find something else to call yourself, okay? And so I said, well, you know what? Vegans are not accepted in general. But of the vegans who are accepted, the ones who are accepted by far the most and can easily obtain sponsors in comparison with the low-fat vegans are the ones in the moderate fat. And a lot of the moderate fat ones, in my opinion, I would think they're really kind of high fat. And so I said they're like what Malcolm X said. The really low-fat vegans like myself, we're like the field Negroes of veganism. And by the way, I'm Puerto Rican. My family's part black, okay? So people sometimes make a fuss about that. It's just the reality of it, okay? So Malcolm X made that point, okay? And then, you know, Martin Luther King was trying to get everybody to get along, okay? So the big controversy came out of this next slide here. I said, well, you could look at this as like a field Negro approach to veganism. It will never be accepted by mainstream society. And I get insulted all the time for not promoting good fats. I've been kicked out of Facebook groups because I said soy is a bad food. I think the purpose of soy is to sterilize people. Okay. And then I said this is a doable way, this California School of Nutrition, the Dr. Mcdougall diet, a doable way that people could be healthy. Okay. You got to be a little obsessive compulsive to do these things. I think regular people aren't going to go down this path, but this is doable. And this leads to very good health for regular people. Okay. And so that's what I said. And I said, in my opinion, this is like the House Negro version of veganism, that it pretends to be an optimal thing, but it's not. All the fat involved with these things here, like the soy, the olive oil, the canola oil, the omega-3, the nuts, the seeds, etc. And there's advice sometimes from persons in that group saying, drink 8 cups of water a day. And I'm like, well, if you got all the estrogenic chemicals in your water and you don't filter it out, you're not going to lose much weight. I see all kinds of fat ladies walking around with gallon jars and a straw, and they're sipping water all day. I've never seen one of them lose any weight. So anyways, this was a slide that launched 1,000 ships and got some people mad at me, but I think it's a true metaphor, okay? It is. Now here's a picture of Dr. Mcdougall with Dr. Roy Swank. He was the neurologist from Canada originally who then went to Oregon, and they worked together on multiple sclerosis. And also I make the point, look at Mcdougall. He's a vigorous guy, okay? I know he has a little bit of problem with his left arm, but just look at him. He was like the best nutrition health speaker in the world in his 50s and his 60s. He's not some weak, sickly stroke patient, okay? Oh, this is the work of Swank showing that the red blood cells are stuck together by the dietary fat. You can call that rouleau formation, meaning stack of coins in the French word for it. It's also called blood sludge. And the molecules that stick the red blood cells together are fat, okay? Postprandial, after eating, the dietary fat. LDL cholesterol, that's a bridge molecule, sticks the red blood cells together. Fibrinogen, the clotting protein, sticks the red blood cells together. Uric acid sticks the red blood cells together. IgM antibodies in the acute infection response. That's why acute infections like sepsis or localized things, pyelonephritis, will have a tendency to cause thrombosis, means clotting, okay? Also, LPS and LTA, the bacterial endotoxins, are very prothrombotic. Excessive free iron in the blood from iron overload, from eating a lot of meat, from eating iron-fortified processed foods, those also make the blood prothrombotic, and they cause an amyloidogenic type of clotting. And again, the work of Douglas Kell and Etheresia Pretorius shows that best. Okay, but what I'm trying to show you is Mcdougall is exactly right. Okay, now here's the deal with leaky gut. Let me get myself out of here to show you the slide. Normally, dietary fiber is taken up by the good gut bacteria, and you only need to know two types of gut bacteria. There's good bacteria and bad bacteria. The good bacteria are symbiotic with us, mutually beneficial. They eat the fiber, they make it into short-chain fatty acids. Most important one is butyrate, 4-carbon butyrate. It goes into the enterocytes. The gut's called the enteric tract, so the lining cells are called the enterocytes. And they are connected by tight junctions. The tight junctions block anything from getting past this lining. You don't want the lining of an organ is also called the epithelium, so you don't want anything getting subepithelial. All right, and you got a lot of immune cells in here ready to fight anything that gets subepithelial. But the key thing is butyrate protects it. And also this butyrate, it also gets into the blood, goes to the brain, and protects the blood-brain barrier. You need to know that. Fiber converted by good bacteria to butyrate. Butyrate protects the gut wall and making tight junctions, and also is used to make tight junctions in the blood-brain barrier. You need to know that, okay? All right, now here's a whole bunch of things that damage the gut wall. There's like over 25 of them. So if anybody's got an autoimmune disease, if I had an autoimmune disease, the first thing I would do is avoid all these things right here and eat more dietary fiber to protect the wall. Because once these tight junctions break down, then, you know, the SH, you know what, T hits the fan. LPS, bacterial endotoxin, gets through. LTA, bacterial endotoxin, gets through. This is the gram-negative bacterial endotoxin. LPS, lipopolysaccharide. LTA is lipoteicholic acid. The gram-positive bacteria endotoxin, they get through. They're very prothrombotic. They incite an immune response, inflammation of the gut, localized inflammation of the gut right here. It'll cause irritable bowel syndrome. It'll cause ulcerative colitis. It'll cause Crohn's disease, for example. Big chunks of protein can break through. Normally, you'll only absorb a tripeptide. So a tripeptide means 3 amino acids at a time or smaller. Dipeptide 2 or an individual amino acid, okay? And the body's not going to form an immune response to that. But when you start absorbing these big chunks of protein, and they're coming from an animal, they're different enough from our body that the immune system recognizes them as foreign. They're similar enough to our body that it will cross-react with proteins in our own body. MAMPS means microbial associated molecular patterns. PAMPS means pathogen associated molecular patterns. So anyways, we form antibodies, then they cross-react with our own body, and that's the most common mechanism of autoimmune disease, okay? And Dr. Mcdougall taught the whole world about this. Like I said, I had memorized the medical books backwards and forwards, and this was not in there, okay? A woman I love, her mother died of lupus, and I might have been able to save her if I had known this, and it pissed me off. You know, I searched the books, I couldn't find it, and I didn't know about this work or these papers at that time. And that made me rather sad and a little pissed off. Okay, here's a picture of a brain with multiple sclerosis. This is a FLAIR MRI sequence, suppression of the cerebral spinal fluid centrally in the cerebral ventricles. All these white things here, these high, bright things, are called demyelinating lesions. And the characteristic perpendicular orientation relative to the lateral ventricle, that's called a Dawson's finger. So anyways, this is the work of Roy Swank showing that, you know, why are people getting multiple sclerosis? One study here shows that there's cross-reactivity, antibody cross-reactivity between casein, the milk protein, and the brain proteins causing demyelination, okay? That's an indicator that dairy is strongly associated with multiple sclerosis, just as it is with type 1 diabetes. And I'm saying is you darn well want to protect your abdominal gut wall and your blood-brain barrier. This is a beautiful painting by Don Troiani, okay, when they burst through the wall, the border wall here, where the British with the German Hessian missionaries back in 1776 came to break through, okay? And I remember this scene from the movie A Few Good Men with Jack Nicholson as Colonel Jessup and Tom Cruise, the lawyer, as Lieutenant Caffey. Okay, so Colonel Jessup says, "You want answers?" Tom Cruise, Lieutenant Caffey, lawyer, says, "I think I'm entitled to them." Jessup, "You want answers?" Caffey, "I want the truth." Jessup, "You can't handle the truth. Son, we live in a world that has walls, and those walls have to be guarded by men with guns. Who's going to do it? You? I have a greater responsibility than you can possibly fathom. You curse the Marines. You have that luxury. You have that luxury of not knowing what I know. And my existence, while grotesque and incomprehensible to you, saves lives. You don't want the truth, because deep down in places you don't talk about at parties, you want me on that wall. You need me on that wall. Okay? So the point that I'm saying is you better protect your gut wall, or you're going to have a lot of health problems. And if your gut wall is leaking, guess what? Your blood-brain barrier is probably leaking too, and your cognitive function is at risk. I can tell you my own personal experience, my internal medicine colleagues, almost every single patient 60 years and older is cognitively slowed in Western hospitals that eats a Western diet. They're not frankly demented. They can find their way home, but, you know, they've lost the capacity for intellectual nuance, and it's kind of sad and pathetic. Okay, so this is what we were talking about. The gram-negative bacterial endotoxin LPS, gram-positive LTA gets in there. It causes a change in the secondary protein structure. The normal protein structure of fibrinogen should be what's called alpha helix, cylindrical, looks like a slinky. Okay, the hydrogen bonds are intramolecular, between parts of itself. But then they straighten out and they become like what's called secondary protein structure, beta-pleated sheet, and they will stack up upon each other, and they will then form hydrogen bonds intermolecular between the adjacent molecule. And the bigger a molecule gets in aqueous solution, water-like solution of the human body, the more like it precipitates out, becomes solid, which is the forming of a clot, but it's an abnormal clot. This change in secondary protein structure is called an amyloid transformation. It's very much like a prion transformation. And these clots are refractory to lysis, to being dissolved. They're called dense matted deposits. Again, this is the work largely of Douglas Kell and Etheresia praetoris. What did I basically say is it makes you more likely to clot and get sick. Okay, and also the cells in the brain, what I'm talking about here is your neurons. They also have glucose type 4 transporters, meaning that they are vulnerable to insulin resistance. So what I'm saying is the fat-induced insulin resistance is not just affecting your skeletal muscles, diabetes in your body outside of your central nervous system like your brain and spinal cord. It's affecting your brain cells, your brain neurons. And so it's a cause of cognitive impairment. So like the stupidest people I meet typically as patients are like my kidney failure patients. They got tons of problems. Cognitively, they're notoriously very slow. But I'd say the second stupidest group of patients I meet is my diabetes patients. Diabetic patients are notoriously cognitively slow, okay? And this is a part of that reason, okay? I've given more talk about this in previous lectures, but the fact that neurons have glucose type 4 transporters, this was not known. This is not in any of your standard medical textbooks. This is from reading the literature on it, okay? And it's a pretty useful thing to know. Okay, blood-brain barrier protection, damaged, protected by short-chain fatty acids and damaged by the lack of dietary fiber. So I'm making an important point. Short-chain fatty acids, butyrate. So part of what I'm doing here is Dr. Mcdougall and his mentors, they figured out, like Swank, you need to protect your brain by eating more dietary fiber and less fat. And what I'm showing you is now the molecular biology papers have confirmed all of this in more detail than was previously available. Same old thing, another paper. Short-chain fatty acids ameliorate problems and you get less brain damage in mice. Fiber protects the blood-brain barrier, okay? That's where these short-chain fatty acids come from dietary fibers. And what does it say? Short-chain fatty acids could rescue hippocampal neurogenesis decline. They could improve blood-brain barrier damage. And they could suppress microglial activation and neuroinflammation. So what he's basically saying here is if you don't eat your dietary fiber, your blood-brain barrier opens up, your brain becomes inflamed, the immune cells of the brain, like the microglia, get activated, and the inflammation damages more brain cells. So you get a vicious circle going, okay? And I can tell you, anything that opens up the blood-brain barrier tends to open up the gut barrier. So when a person has a stroke, when a person has traumatic brain injury, they're opening up the gut barrier, and it's a double bad because now toxins are getting through the leaky gut, and then they can get into the blood, and they have an increased chance to get across the blood-brain barrier. So when you stroke or get a traumatic brain injury, you have the central core of dead tissue, but you have a peripheral spot that's called penumbra. Penumbra means like twilight. Those are damaged neurons that are not yet dead. They could go either way. They could be restored to life, or they could progress on to damage. So what I'm saying is knowing the stuff about dietary fiber and the benefits of low-fat plant-based diet help you protect brain cells in the context of acute neurologic injury like stroke or traumatic brain injury. Okay, this is just more of Swank's work, and he also showed that the high fat amounts in the blood would cause tissue hypoxia, and that would lead to ischemia of the tissues, lack of oxygen, and that would damage the tissue. And he felt that the damage to the blood-brain barrier from the high-fat diets was also causing autoimmune disease, damaging the permeability of the blood-brain barrier, allowing the autoantibodies to get into the brain parenchyma and cause damage. That's the work of Swank. And his work was confirmed by, other researchers like Peter Quo, the cardiologist in Philadelphia, Pennsylvania in the 1950s, Meyer Friedman and Ray Rosenman, the ophthalmologists in the 1960s. It goes on. And the omega-6 oils were worse than the saturated fat. Okay, here's Dr. Mcdougall. He's well aware of all the problems of high-fat diets and cardiovascular risk. He even had this tattooed onto his chest, "Do not cath, I will sue." Okay, the high-fat diets cause thickening of the blood. In normal blood, you can see through the plasma. Here it is in a test tube, whereas it becomes opaque here. In the movie Game Changers, you saw a picture to that effect. Okay, this is the work of Peter Quo. He basically checked blood lipid levels every 30 minutes, and what he saw is after feeding people a meal, initially with saturated fat, they'd peak at about 3 to 7 hours. During peak lipemia, highest fat in the blood, they get the most episodes of chest pain tightness. He was a cardiologist. These were patients with cardiac angina, known atherosclerosis in the coronaries, and they would get their episodes of chest pain. A worrisome thing when lipids were highest in their blood. And this was done, there was no IRB in those days, institutional review boards. And this is the 1950s. And they had no angioplasty or stent to treat these patients. They're lucky these patients survived. Okay, anyways, if you fed, then they later tried repeating these experiments with PUFAs, polyunsaturated fatty acids, the omega-6 cooking oils, and it caused more prolonged blood sludging. So what I'm saying is you're screwed either way. The other thing you get with PUFAs, polyunsaturated fatty acids, is you get lipid peroxidation because you have the double bonds, then you have the carbon in the middle. It's called the methylene bridge because the CH2 is a methylene group. The double bonds are pulling on the electrons. That hydrogen often gets plucked off. Oxygen sticks to it. When oxygen sticks to it, two adjacent oxygens, that's a peroxide. It's a fat, so it's lipid peroxidation. That causes a chain reaction that trashes membranes and can damage other tissues, including proteins. And you form a toxic aldehyde called HNE, hydroxynonenal. That causes brain damage, pancreatic damage. It's bad. Tetsumori Yamashima, the Japanese neuroscientist, is the one who pioneered that work. And the reason I'm mentioning it, it's a confirmation, a molecular biology, biochemical explanation of why Peter Quo, Roy Swank, Dr. Mcdougall, and these early pioneers were correct about what they're saying, the problems with fat. Okay, red blood cells are typically about 7 microns. You want to know that. Capillary is typically about 5 microns. So the red blood cell has to deform to pass through that capillary, fold back on itself a little bit. Okay, when the red blood cells are stuck together by bridging molecules like chylomicrons loaded with fat, LDL cholesterol increased with fat, then you're pumping a milkshake instead of water through these capillaries. And you got to pump a higher pressure to go against gravity to get that blood to the top of the brain. Okay, the higher the LDL, the thicker the higher the blood viscosity because the RBCs are stuck together. Okay, the RBCs have a negative charge on their outer surface. It's called a zeta potential. The zeta potential is provided by the heparin sulfates, cholesterol sulfates, and the sialic acids. These negative charges mean that two adjacent red blood cells will repel each other, which is what you want. You don't want them sticking together, so you don't form clots. Okay, in the real world, people die from clotting. They die from heart attacks. They die from strokes. All right, and when a blood vessel is plugged up, makes tissue ischemic, hypoxic, lack of oxygen, it's at increased risk to get cancer. Okay, so blood clots, atherosclerosis is a blood clot, by the way, that kills people. All right, so all these bridging molecules, which we just talked about a bunch of them, IgM antibodies in acute infections, LDL cholesterol, chylomicrons, fibrinogen clotting protein. You get elevated fibrinogen, by the way, when you're stressed out. That's why being psychologically stressed is bad. That's why sleep deprivation and caffeine, which raise the same hormones, catecholamines, adrenaline, noradrenaline, and cortisol, are bad. Okay, and what I'm saying is caffeine raises the exact same hormones. It's bad. All right, that's why I recommend zero caffeine. All right, uric acid does it in the gram-negative endotoxins, LPS, and LTA. Plus, if you have excessive free iron in the blood, which comes from processed foods that are iron fortified or from things like red meat, eventually people develop iron overload, and then that predisposes them to oxidative stress, which has a similar effect of it becomes autocatalytic in the blood, ferrous redox cycling between Fe2 plus and Fe3 plus. Again, you see this in the paper by Douglas Kell, and he's got lectures about this on the internet as well. And there's a bunch of books written about the effect of excessive iron in the blood. I've given previous videos about them, okay? And you'll see that those are the big common prothrombotic things. There's other less common causes of being prothrombotic, but being stressed out, eating a poor diet are the two main things that you need to know about. Okay, so when the red blood cells are stuck together, the blood pressure goes up. Normal blood flow is like laminar flow. You got the red blood cells in the center, then you got the white blood cells adjacent, you got the plasma like this. It's a parabolic velocity profile when it travels down a vessel. And then when it comes up at a bifurcation, it hits the median divider of soft tissues at the branch point. Here, for example, is external carotid going to the face, internal carotid artery going up to the brain. You can remember it like your thumb at the side here. My thumb is like the internal carotid going up to the brain, and then these little fingers, all the branches of the external carotid. Anyways, it hits the median divider, and it bounces off of it. When it bounces off it, it comes back as turbulent flow, and you get these slow retrograde eddy currents. All right? If there's an excessive amount of turbulent flow and retrograde eddy currents, the endothelium, the arterial lining cells just beneath it, they sense that as arterial injury. They shed their antithrombotic glycocalyx, and they express prothrombotic molecules. The bottom line is you're predisposed to form a blood clot right at the spot here, opposite of the median divider at bifurcation. It's the same issue in all the coronaries where there's a lot more bifurcations. There's only one bifurcation in the common carotid artery in the neck. There's tons of them all throughout the coronaries. and the smaller arteries of the brain. And you're forming atherosclerosis at these spots if you got hypertension. Hypertension, the biggest risk factors of atherosclerosis are high-fat diets causing hypertension, and also the fat itself, making things stick together and be more prothrombotic, okay? And then that also leads to diabetes, which is also atherogenic, okay? So this is what happens. This is what's causing atherosclerosis all over your body. You want to avoid that? Minimize your dietary fat, okay? Here's Dr. Mcdougall's, one of his other great books, Digestive Tuneup, and then the question often comes up, why did Dr. Mcdougall die? And, we don't know exactly for sure. The family declined in autopsy, but there are some things we do know. This is a picture of him when he's 59. Again, he was a pretty robust, healthy-looking guy. Okay, he had some small amount of residual weakness in that left arm, but not so bad. Here's what he wrote in his book, Digestive Tuneup. He was born in 1947. He said, I regularly windsurf in the deep blue ocean, strap my grandson into a backpack, and carry him on a mountain hiking adventure. So anyways, he had a catastrophic problem when he was 18 years old. He had a big stroke. For 2 weeks, he was paralyzed on the left side of the body. So he had left upper extremity, lower extremity paralysis, hemiplegia. And, like I said, he's a pretty tall guy, 6 feet tall. He was fat at that time. He got as fat as 228 pounds. He died when he was 77 years old. He had a bad fall apparently with a pelvis fracture about 10 years ago. He said he had some type of ear infection that affected his sense of balance, and then he fell. I don't know if he fell on some stairs or something, but it was a bad fall, and he had a pelvis fracture, which made him a little weaker and debilitated. About 7 years ago, his house burned down, and he lost all his possessions, including his car and his library, so that was pretty devastating. Greatest doctor in the world's homeless. He then had reestablished his baseline, and there's videos for him a week before his death where he's totally with it. Other people, some people said, oh, well, he died at 77, he wasn't that old. Well, one of the things I would point out is mentally sharp. His video a week before, he's totally mentally sharp. Okay, the typical SAD diet eater, Western diet eater, they're, cognitively quite slow by the time they're 60. He was 77, totally mentally sharp. And you can look at the other, low-fat vegans, Esselstyn, etc., how sharp they are, T. Colin Campbell, for example. Okay, and there's other ones. Let's see, this totally different than the typical old person with cognitively slowing. What did he die? What causes sudden death? There's a couple different things that will cause sudden death unexpectedly. You can get it with a cerebral aneurysm rupture and subarachnoid hemorrhage. You can get it with an abdominal aorta aneurysm rupture. You can get it with a pulmonary embolism. You can get it with myocarditis. That can do it. You can get it with myocardial infarction, idiopathic ventricular fibrillation. So we don't know for sure. You can think about that, but it was something sudden and unexpected. This was just some slides of, I was reminded of Don Quixote, whereby, they burned his books and they mocked his work. This is all the thanks you get for being a low-fat vegan. And here, they sort of ganged up on Don Quixote, and they took his books from his library when he wasn't home, and they threw him into fire, and they burned his books in a fire. Just a coincidence. Reminds me of Dr. Mcdougall. Okay, here is Don Quixote standing up to the giants of conventional medicine of his day. Anyways, Don Quixote was very brave. Okay, luckily the giant wasn't too hungry at the moment he stood up to the giant. Luckily, hopefully, big meat, big dairy, big pharma, big mammal. Okay, here's a picture of Dr. Mcdougall giving a lecture. I don't know how old he is in this picture. I predict maybe about 60 to 65 in this picture. What I'm trying to show you is look how robust he looks. He was a very powerful speaker, okay? And look, he's using his left arm. His left arm is held up. He's not like some weak rehab stroke patient, okay? He's a robust, energetic, brilliant genius, okay? Other thing I noticed is you see him in his older days, he got kind of skinnier, a little frail looking, but he still kind of looks like a tough old, Irish guy. He kind of remind me of Popeye the Sailor Man when he goes on his little rants, okay? He's totally mentally sharp, okay? He's completely mentally sharp. Okay, one quick picture of the brain. Here's a picture of the brain looking at it from below. Here's the carotid arteries that go into the anterior circulation of the brain. The carotid artery bifurcates in the anterocerebral artery and the middle cerebral artery. This feeds the side of the brain, and this feeds the midline parts of the brain. And this is above what's called the tentorium. The tentorium separates the posterior inferior brain, meaning the cerebellum and the brainstem. Okay, that is fed by what's called the vertebral arteries. The two verts come up together, join to form the basilar. This is called the vertebral basilar circulation. Okay. And I'm going to show you this because when you talk about a stroke, you're going to be talking about an anterior stroke or a posterior stroke in terms of brain blood supply. And here is the internal carotid artery coming up into the brain. I didn't draw the anterior cerebral artery because it'll make the picture too complicated, but the ACA would go in through here. The MCA, middle cerebral artery, goes out to the side, then wraps around the convexities of the brain. These are called convexities because they're convex outward. Okay, and right in this area, if you injure the lenticulostriate arteries or toss an embolus into them, you'll get a basal ganglion infarct. These look like little holes. They mimic the course of the artery, and those are called lacunar infarctions. Lacune means hole. Okay. There's other types of stroke that occur in these upper parts of the brain. Usually when people think of stroke, they mean a big convexity stroke. But in reality, these little lacunar infarctions are much more common. I see all this stuff all day long, every day. Here's a lacunar infarct in the brain. This is on the left side of the brain. You can tell what side is what of the brain. Here, let me get my picture back in here so I can show you. Imagine you walk into a room and the patient's feet are towards you. Always imagine the patient's feet are towards you, because that tells you if this is patient's feet are towards me, this is the right side, this is the left side. So this is a left-sided lacunar infarction, and this location is about where Dr. Mcdougall's stroke probably occurred. This is at the junction of the posterior limb of the internal capsule between the arm and the leg. HAL is a little man who lives in the internal capsule. HAL, that means head, arms, and legs. That's where the corticospinal tract fibers go in the brain. Okay, so his stroke, given that he had left-sided hemiplegia, was probably on the right side of the brain because they're going to cross over in the brainstem. But the point I'm making is he was said, I've heard people say that knew him better, he had at 18 years of age a lacunar infarction. Okay, that's what was told me. And a point I want to make too, and here's what a lacunar infarct looks on brain MRI. This is called DWI, diffusion weighted imaging of the brain. Okay, so this is the equivalent stroke. Okay, this is just the surrounding anatomy. Here's the thalamus in contact with the lateral ventricle. Here's the caudate nucleus in contact with the frontal horn of the lateral ventricle. Here's the insular cortex right over here, like a little island. And this is the temporal lobe. If you look at your hand, let me see if I can show you. Gonna get my hand in here? Okay, your thumb is like the temporal lobe. This part here is the frontal lobe, right behind this midline vertical crease. This is the parietal lobe, and then way in the back, that's the occipital lobe. So you can make the anatomy of the brain. Okay. This is like sort of the basal forebrain, this part where the basal ganglia are, these big nuclei. Anyways, he was said to have had a lacunar infarct. Oh, is that all the slides I got? I thought I wanted to show one more slide. I guess that's all I got. And so what I'm trying to say is back in the day, when he was said to have this lacunar infarct, it was about 1965. They didn't even have CAT scans available. CAT scans were first called, like EMI machines, electrical musical instrument machines, because the Beatles provided a lot of money to fund the research to make CAT scans. There was a English physicist, Geoffrey Hounsfield, and units of density on CAT scan are called Hounsfield units. So the point I'm saying is CAT scan wasn't available when Mcdougall had a stroke. What they probably did was they took him to a catheter arteriogram, injected contrast dye to opacify the vessels, and they didn't see any big vessel occlusion, so they said, oh, it must have been a lacunar infarct. I don't know if he ever had a follow-up CAT scan or not. If he had a follow-up CAT scan, he would have something like this, a little hole in the brain. That would be a lacunar infarct. He might not even know for sure if he had a lacunar infarct. They just told him that by their assumption, because you have a much better chance of recovering from a lacunar infarct than you do from a big convexity stroke. And why am I going through all this? Because what I'm saying is a lot of people said, well, his recent demise was probably sequela of a stroke. And I'm telling you, I don't think so. One of the things I do is I'm a neuroradiologist, okay? I see many tens of thousands of strokes. And I can tell you, an 18-year-old almost always gets a stroke from a post-traumatic dissection. They can be spontaneous, but usually there's some underlying trauma in there to begin with. And it's a one-time event. It's not an ongoing progressive disease. Where the typical old person having a stroke, they're hypertensive, diabetic, obese, with atherosclerosis diffusely in their body. No. Mcdougall wasn't like it. He was an 18-year-old guy. Okay, usually most 18-year-olds, fat, sick, smoking cigarettes, you name it, they don't get strokes. Okay, so it's usually a unique post-traumatic event, and it's not part of a bigger chronic systemic disease. Okay, here are some quotes of Dr. Mcdougall, some of his best quotes. It's the food. He recognized and pointed out to everybody else, it's the food. Animal foods and oil are the major poisons in the American diet. Salt and sugar are the scapegoats of nutrition. The fat you eat is the fat you wear. The more fat you eat, the fatter you get. Fat paralyzes the insulin receptor. He also said fat causes blood sludge, sticks the red blood cells together, and it causes hypertension. That's a pretty big problem for fat, don't you think? It causes diabetes and hypertension, the two most important diseases in the Western world, and obesity, the three most important diseases in the Western world. And they all lead into atherosclerosis, which leads to heart attack, stroke, and cancer. Okay? I mean, what more could you want? What more could fat do to be recognized as a major problem? Okay? And we talked about him working with Swank and showing how it sticks red blood cells together. Okay, he said oils are even worse for causing blood sludge. And he showed the papers about Meyer Friedman and Ray Rosenman and their work in the 1960s. And by the way, I learned about all this stuff from Dr. Mcdougall. I was trying to solve my own health problems, and I read everywhere. And the most valuable books that I read and papers that I read were those of Dr. Mcdougall. He introduced me to all his mentors, and I'm like, holy crap, this is where the most useful information is in all of healthcare. The work of Pritkin, the work of Kempner, the work of all these scientists here, Meyer Friedman, Ray Rosenman, Burket, okay, Dr. Mcdougall. All right, so Dr. Mcdougall quotes continue. Animal foods and oils lead to leaky gut. Then people end up with molecular mimicry and autoantibody cross-reactivity. That's the main cause of autoimmune disease. Also, with regard to fats, he says it doesn't matter what types of fats it is. Oils are even worse than saturated fat for causing blood sludge. Meyer Friedman and Ray Rosenman showed this in the 1960s. There's plenty of omega-3s in plant foods. I want to make that statement because there's some controversy about this. I think it's fake controversy, but there's a lot of people trying to say that omega-3s are some wonderful health food. Mcdougall said this repeatedly and clearly. There is plenty of omega-3s in low-fat plant foods. You get all the omega-3s you need in low-fat plant foods. I studied that pretty extensively, and I agree with Dr. Mcdougall. Okay, Mcdougall continues. A hot dog is a ground-up animal. It contains thyroid tissue. This can lead to autoimmune thyroid disease. People love to hear good things about the bad foods they eat. Starch has unlocked the door to good health for thousands of my patients. All healthy populations eat a starch-based diet. There are no exceptions. Humans are starchivores. With asymptomatic patients, there is zero benefit from screening colonoscopy. Colon polyps often regress when a person changes their diet. Mastectomy doesn't add 1 day to your life over lumpectomy. Treadmill stress test is a conveyor belt to cardiac cath lab and operating room. Coronary artery stents and bypass surgery do not extend life, not at all. I have a tattoo on my chest that says do not cath. I have often been asked, why do you speak against the practices of fellow physicians? And my answer is simple. I never took an oath to protect the financial interests of the medical industry. I took an oath to care for the sick and to try to help keep them from harm. Starch should be our primary source of digestible carbohydrate. Digestion of starches is a slow process that gradually releases the sugars from starch, which then goes from the intestine to the blood. Fruits offer a quick burning energy, mostly in the form of simple sugars, but little of slow burning sustaining starch. As a result, fruits alone won't satisfy our appetites for very long. Starch is much better for satisfying hunger than fruit. The average American diet, which is about 70% meat and dairy, 5% fruits, 5% veggies, 20% starch. Whereas the Mcdougall diet has 0% of calories from meat or dairy, 10% of calories from fruit, and 20% of calories from veggies. Approximately 70% or more calories from starch. He even would say it's okay to eat 90% of your calories from starch because that's what a lot of populations do, the healthy ones. As a beverage, he recommended just drink water. We humans are built to thrive on starch. The more starch we consume, the healthier we become. Starches include rice, corn, potatoes, sweet potatoes, beans, peas, barley, millet, oats, rye, sorghum, wheat, and squash. If you could take just one message from this book, this was his book, Starch Solution, he says, it would be eat more starch. Humans are starchivores. And so that's the deathbed of Don Quixote, the deathbed of Dr. John Mcdougall, the greatest doctor who ever lived. And I think it's our responsibility of people who know about this to teach others and keep his legacy alive. So thank you. I hope that was helpful.